I'm Yawa Degboe with Arlington Public News. I'm here with Bill Massacoy.
Good morning, Yawa. Thank you. It's my pleasure to be here this morning. I am the founder and executive director of Rebuild Africa, which organization was founded actually when I was a student here in Boston. I did my graduate studies here at MIT. So shortly before I left, I got a few of my friends together and we started this organization. And the objective of Rebuild Africa is to support education, training and mentoring back home. As you know, because of the many years of civil war in Liberia, a lot of people died. Many of the professionals left the country and educational institutions were damaged. Mm-hmm. So one of the things that going back that I thought I would do was to go and help build up the human resource infrastructure in the country. So that was the vision behind the founding of Rebuild Africa.
And now Ebola, obviously.
Yes, now Ebola, because it looks like everyone's attention is turning to this deadly virus. As you know, it's very virulent. It has killed over 3,000 people now in Liberia, Sierra Leone, and Guinea. And over half of the people who've died so far are from Liberia. And the disease is spreading very rapidly in Liberia as well. So that's a very sad situation.
How did it change the mission of the organization?
Well, I wouldn't say that it changed our mission per se, but it certainly made us to, I wouldn't say stop, but to deal with the emergency. Like when people are dying, you need to keep them alive before you educate them, put it that way. So all of a sudden, all of us who run local organizations found ourselves grappling with this virus. It's not only threatening our various organizations, but our very lives, and indeed the existence of our country. So I guess at this point, it's all hands on deck because we all need to do our part to fight this disease. For our part, Rebuild Africa, one of the things we did, because we knew we were not a health institution, so one of the things we did was to partner with a mission organization. They run a hospital, and this hospital has been the very first in the front line of fighting the Ebola. If you remember, 3 of the U.S. health workers who got infected in Liberia, Dr. Bentley, Nancy, and Dr. Rick Sikra all worked from that hospital. In fact, I had the privilege of working with Dr. Sikra many times, many occasions, trying to raise more support to support the Elwa Hospital in Monrovia until he got infected and was brought to the U.S. For treatment. So we have joined them. We support them and we raise resources and channel it to them to help them fight the disease, and that's what we're doing.
So which kind of resources do you need?
Well, we need a lot of resources, by the way. But just in terms of what we provided to the hospital, we've provided a lot of energy drink, because when people are infected with Ebola, they are dehydrated. They lose a lot of fluid, and so they need to rehydrate very often. So we provided a lot of energy drink for the patients. We provided things like bed sheets, beddings for the clinic, because a lot of the Ebola patients, they have running stomach and they stew a lot. And so many times the bed sheets are soiled. And as you know, Ebola is also passed by body fluid. So things like the poo, the pee, the saliva, and those kinds of things are the medium through which Ebola it's passed on to other people. So the hospital has got to change the beddings quite often, because people stew on the beddings, then those beddings have to be discarded or burned, and then new ones. So a typical patient might need, maybe up to 20, 21 beddings before they're, if they survive before, they're. And then we also provide other support. For example, we also provide them some cash donations. And this cash donation goes basically to support health workers. Because in Liberia, health workers are paid very low. And so when the Ebola crisis erupted, a lot of health practitioners left the hospital. They ran away because A, they were very afraid for their own lives, but B, because their pay was very low. So by providing the hospital assistance, they were able to bring by some more nurses, who were willing to volunteer to take care of the sick patients. We helped them to provide allowances. We helped them to provide transportation allowances so that those staff could continue to come and serve those who were sick.
And yourself, how do you feel?
Well, I mean, in terms of health, I'm very healthy. Thankfully, I'm doing very well. I've had some friends who have been affected, some friends who have died, which is very unfortunate, but I'm thankful that I'm still alive. I'm here today, so I'm very thankful. But it's sad, because even as I sit in this studio, I'm not in Liberia, but I do know many people who are suffering, many people who are being affected. Every time I take a call from Liberia or turn to my email or look at my Facebook page and my friends, I do see someone that I know who's getting affected, So it's a very sad page in our lives as a country.
So could you remind us how people contract Ebola? How do they get infected? And what's contributed to the spread of Ebola in Liberia?
Right. Well, when you look at the spread of Ebola, basically it is spreading through, say, two major avenues that Ebola is spreading. One is through family members who provide care for the sick. Because the Ebola virus presents itself like any normal sickness. The symptoms are not unique. For example, when you contract Ebola, the first thing that happens is that your temperature goes up, and that's what happens when you have malaria. So if you present yourself at a hospital with high temperature, most times the health workers do not know whether it is Ebola or it is malaria. And in the beginning, there were no labs to test, that in fact you had Ebola. So many people who presented themselves at hospitals were thought to have malaria instead of Ebola. And that's how come many of the health workers got infected as well. So basically, like as I was saying, two ways in which people get this Ebola. One is through family members who are caring for the sick, and the second way has been through the health workers who are providing care to these people, because most times they're providing care without any of the protective gear that they need to deal with Ebola. And so, a person shows up in the hospital, they have to run IV fluid, they have to, examine them, and usually they're not aware that this person has Ebola, and by the time, a few days passes, a week has gone, then you find that the health worker is sick also, and it cannot work. And so he or she gets infected, and if not careful, then she infects other health workers as well. So it's really been spreading like wildfire. We've had families in which almost nearly all members of the family have died from Ebola. There are places where a whole family has been decimated, completely wiped out because of Ebola. Because in Africa, we also have very strong culture. It's very communal. When you do get sick, there are people who come to take care of you. There are people who are always there to serve you and to make sure that you receive everything you need to get well. And unfortunately, there's sometimes, at least in this case of Ebola, it's showing that doing that for a family member or a relative, it's just not the right thing to do. But it's what people are having to do. I mean, imagine if you were to have a child that is 3 years old, and he or she comes down with Ebola, and you go to the hospital, and all the hospitals are closed. There's nowhere you can take your sick child. I mean, what are you going to do? Leave your sick child in the street to die? You're not going to do that. So people are having to take their sick back home, in their homes, in their communities, to take care of them, to nurse them. And unfortunately, by doing that, they're spreading Ebola.
So Now, how does interaction between human beings, interaction between people, how Ebola changed that?
Very dramatically. I mean, Ebola has changed the way we interact. In Liberia, it's very easy to shake hands, to snap hands. It's very easy to hug people, you know. But because of Ebola now, you can't do any of that. For the past couple of months, we don't shake hands. We don't hug people. We don't come close to other people. And it's difficult because you have a country in which, if there's anything that is a signature of the warmth of the people, it's the way they embrace you, the way they, you come from West Africa, so you know what I'm talking about,
I know
So, yeah, to not do that, it's difficult. And then when even there are other traditions as well, like burial traditions, for example, when a relative dies, especially if it takes place in a village setting, usually the tradition is that the dead would be washed clean, would be dressed in a beautiful garment or clothes before they're buried, But because of of the Ebola, that's not happening anymore. Many people, I think in the eyes of West Africans or Liberians in particular, are not receiving dignified burials. In Liberia now, bodies are being cremated instead of being buried. So if someone shows up at a clinic infected with Ebola and they pass, they're immediately put in body bags and taken to a site and they're burned.
Whether they have Ebola or not?
Yeah, whether they have Ebola or not, unfortunately, because it's in some cases it's possible to tell that this person did not die from Ebola, but also because of the difficulty of knowing who died from what. Because now you have people dying in the streets, for example. So if you met a dead body in the street, how do you know it's an Ebola death or not? So to take the precaution, usually the bodies are left in the streets for several days, and then they're picked up and burned. The stigma of Ebola also. A lot of people are. Some people are being abandoned. In rural areas where there are no health facilities, no doctors, no health facilities. Basically, people are being locked up in their houses and left to die because of Ebola. So it's a very sad situation, very, very sad situation. It must be very difficult, for a village, for example, to ostracize a member of the village because they have Ebola. It's difficult. It's really difficult. So in some instances, people are doing that. In some instances, people just can't do that. They just can't treat their relatives or friends like that. So they risk their own lives, to provide care. And unfortunately, they also get affected and they all die.
So at this point, do you feel like this disease, Ebola, will persist? Or do you feel like the rate of infection is decreasing?
At this point, the rate of infection is increasing, but I'm optimistic. This is not the first challenge we've had in West Africa, in Liberia in particular. We had many years of civil war, where there were so many factions, warring factions, gangs, young boys with AK-47 rifles going around killing people. And we were able, for the most part, to overcome that. So I'm very optimistic that this one, too, we will overcome. I'm very optimistic. I think the Liberian people are very resilient. And I believe that we are going to ride this out. We're going to definitely overcome, this disease. And although the infection rate is going up, but a lot of things are happening also. A lot of good things are happening. For example, the international community is getting more involved. The U.S. will be sending 3,000 troops. They're providing, they're helping with building more more treatment centers for those who are infected, more organizations raising support and money in order to support the Ebola, relief fund. So I think that we do have a lot of players. Many people are being recruited or volunteering to participate. So I believe that with the help of our international friends and the Liberian people themselves working on the ground, I believe that we can overcome this. Although it looks like it might get worse before it gets better. Yeah. But I think the key to turning this around would be both trying to work not only in terms of the treatment centers, but also at the community level. We need a lot of health workers, community health workers who can go out and really help the population deal with Ebola. Explain Ebola, tell them how to manage Ebola, that Ebola is not a death sentence for the most part, as it has been seen by many. And that's unfortunate because, you can blame people and the way they've reacted. Treatment facilities, for example, have been inadequate. People get sick, they go to the treatment centers, and there are no space. As soon as a treatment center is built, maybe having like 100 beds or 150 beds, the very next day all the beds are taken, and you have more people coming who don't have access to these treatment beds. So it's grim, but it's not hopeless. I believe that I'm very optimistic that we will win this war.
Yeah. So the first case of Ebola was actually in December, I believe, and the outbreak really started in March. Do you feel like the international organization could have stepped up earlier?
I think so. I think that the response could have been a little urgent. It could have been a little faster than, because, bear in mind that we've never experienced Ebola in West Africa. This is the first one. So our medical system had no experience of how to treat Ebola. And that's the reason why, for example, in Liberia, we have a lot of health workers who got infected because they didn't know it was Ebola. They didn't know how to treat Ebola. If what we know now is what we knew back in December or March, I'm sure we'll be talking about containing the virus now. And you can see that, in countries where the disease fled and they were more aware of the Ebola situation, they have been able to manage very well. For example, in Nigeria, we've had a few cases of Ebola, but they already knew there was Ebola, and so they were more vigilant, for example. In Senegal, where also we've had some Ebola cases, they too have been very successful in containing the Ebola. Even in Guinea, where the Ebola started, they have turned a corner now. But the difference in Liberia is that the epicenter of the disease actually is taking place in the capital city, Monrovia, which is a city of about pretty close to 1.5 million people, highly congested, slum areas where, communities, are so congested. So that's a difference, and that's why the infection rate in Liberia is really alarming because, for the most part, these are communities that are really, really congested. Very packed. With people, basically jumping over each other to do their daily chores. So, and that's the reason why the infection rate in Liberia is high. But again, I believe that we can overcome this.
Yeah. Let's talk about you. What's the purpose of your visit in the U.S.?
Well, this visit actually is twofold. One is, like I said, I have 3 kids here who live here. Our youngest is 7 years old. She came to the States in June for vacation and was supposed to go back in August. Obviously, because of the Ebola, she couldn't go back. So now we have a 7-year-old who is living in the US, and the parents are living in Liberia. And unfortunately, we can't bring her back home now. So it's a very tough situation for us. I mean, every time we talk to her on the phone, she's crying. So we thought it would be good for one of us to come at least to see her and to stay by for a while. So that's why, I mean, at least for a time. So that's why I'm here. The second reason I'm also here is also to talk to my friends and those that I know and well-wishers to say that we need all the support we can get to fight this disease. You know, thankfully we are having a lot more people on the front line fighting this disease on a daily basis, but they need equipment, they need materials, they need support, and those of us who may not be in the midst of Ebola, I hope will see the need to provide the support that those who are on the ground need to fight this disease. So I'm hoping that I can do my part in raising more resources, more funding, to fight this disease.
Bill Massakoy, thank you so much for your hope, for sharing your experience today. I really appreciate it. We really appreciate it, and we wish you all the best.
Well, thank you so much. Thank you so much for this opportunity, for giving me the chance to talk about my country and what is happening there. And I hope that those who are listening to us again will get involved. Get involved. And one of the ways they can do that is by donating today. And again, our website is rebuildafrica.org. And there on our page, we do have a space there where people can go and donate for Ebola. And I hope that our listeners will do that today.
We'll make sure that this information will be viewable by everyone.
Thank you.
Thank you so much.
You're welcome.
I'm Yawa Degbe with Arlington Public News. Thank you for watching.